It's been suggested that medical marijuana can offer relief to chronic pain patients, but many may wonder what the cost, if any, the practice can have. Joining me now to discuss concerns around the use of medical marijuana to manage chronic pain is Dr. Dean Drosnes, Associate Medical Director for Care and Treatment Centers. Dr. Drosnes, thank you so much for being here today.
Thanks for having me.
So, can marijuana be used to treat or to manage chronic pain?
Chronic pain is one of the number of diagnoses that are acceptable for a physician to prescribe or to authorize use of medical marijuana.
We hear a lot now about CBD as an alternative, so is that a viable option?
CBD in the scientific studies seem to have some good pain relieving properties, and that was very exciting initially because CBD in and of itself is not associated with addiction. However, in real life, as we see, there's a lot of CBD products on the market. I'm not hearing patients getting great pain relief from CBD. It also has some, all CBD preparations also have at least a trace amount of THC, which may be a concern for some patients.
So what are your other concerns with marijuana being used as a chronic pain treatment?
Well, in the context within which I treat chronic pain, which is patients who have a substance use disorder as well as a chronic pain condition, part of our aim is to calm down the part of the brain that's involved in the substance use disorder. Marijuana use is not going to allow that part of the brain to calm down like we want it to in order for them to get good recovery.
Excellent, I see. So what solutions might you offer to alleviate the current opioid epidemic in terms of marijuana and using it to manage chronic pain?
Well, I think that for people who have an opioid use disorder, that using alternative methods of treating their chronic pain, acupuncture, massage, hydrotherapy, physical therapy, yoga, meditation, all of these are harmless. All of these will allow the part of the brain that processes chronic pain to calm down and allow the part of the brain that is involved with addiction to calm down and get to its baseline state. Medical marijuana really does not have a place in the treatment of chronic pain, particularly in a patient with a substance use disorder.
And that touches on my next question. Is there any concern about swapping out one addictive substance for another in this treatment?
Yes, there's no question that marijuana has its own addiction liability associated with it. And certainly for somebody who has a substance use disorder, again, we want to allow that part of the brain to heal without stimulating it with a different substance.
And what alternative chronic pain treatments exist that don't involve opioid medications or marijuana?
Well, as I mentioned, there's many alternative treatments, acupuncture, massage, physical therapy, hydrotherapy, as I mentioned previously. But in combination, layering these treatments and individualizing them for one patient, that's the way to go.
And if there's one takeaway you want people watching this to walk away with, what is that?
I think that the most important thing to understand is that most effective relief from chronic pain involves a minimum of drugs and a maximum of alternative therapies.
Excellent. Dr. Drosnes, thank you so much for being here.
Thanks for having me.
And if you're interested in learning more, you can visit Caron.org.